My case is a 7-year-old intact male Coonhound named Duke. He's a hunting dog presenting for what I interpret as exercise intolerance. His owners also say he's had a dry, harsh cough, as well as some weight loss. Otherwise, there's no changes in his appetite, urination, or defecation, at least that they've noticed. He's an outdoor dog that lives with other dogs. Sounds like he's mostly in a pen with the other family dogs or chained to his dog box. Today, the owner is worried about intestinal parasites. It's been 4 years since Duke was last seen in our clinic, which is significant. Scan the medical record, which indicates that he'd been seen yearly for vaccinations and to be checked for parasites. Everything was pretty normal at those visits otherwise. In the record, it does look like he's lost about 2 kilograms since we last saw him 4 years ago. On physical exam, there are only a couple things that I found noteworthy. First, he's thin. I'd say he's about a 3 out of 9 for body condition score. His heart rate does seem elevated to me for what I expect to be a fairly fit hunting dog. He didn't cough on his own in the exam room, but I was able to elicit a cough by tracheal manipulation. Notably, both of his front feet are swollen due to what I interpret as pitting edema, but his rear feet seem fine. Also, I'm not sure about this, but his heart sounds seem displaced, a bit caudally from where I'd expect. However, he's a deep-chested breed, so I might have that wrong, and I'd like you to auscultate to see what you think. Otherwise, I didn't hear any murmurs, arrhythmias, or anything else abnormal. I also didn't detect any musculoskeletal abnormalities that might explain his exercise intolerance. So far, my master problem list would be exercise intolerance, cough, bilateral edema in the front feet, tachycardia, weight loss, and a possible caudal displacement of the heart sounds.
So tell me what your thoughts are on Duke.
So the presenting complaint is pretty wide open. There are a lot of possibilities. We definitely need to better define his problems. It would also be really helpful to localize the process to one or more target organs. I think the cough is one of the more high-yield problems in this case, which makes me think first of either respiratory or cardiac disease. The edema could also support cardiovascular disease, but I need to think about more why it'd only be in the front feet. One possibility could be that something's inhibiting lymph flow or venous return from the front feet, but I don't know what that would be at this point. Another potential organ is the hematopoietic system. Anemia could certainly account for his exercise intolerance and the weight loss. However, his mucous membranes look pink and his capillary refill time is good. Still, I think it'd be a really good idea to do a CBC or at least a PCV. Musculoskeletal disease could also result in exercise intolerance or reluctance to hunt. However, as I said before, I see no evidence of lameness or other signs of musculoskeletal disease on my physical exam. I suppose he could just be nervous here, and so I'm asking some of those signs, but his owner also hasn't noted any lameness at home.
So what would you like to do next for Duke?
With Duke's history, I think there's a couple of specific high-priority differentials that we should rule out first. First, it would be good to address the owner's concerns about intestinal parasites. We see a lot of hookworms out here in Ohio. They can cause a pretty significant anemia, and that alone could cause most of his problems. I would definitely recommend a fecal float and, depending on those results, deworming. It's also a pretty cheap and easy thing to do. One of my other top differentials is heartworm disease. Definitely a problem here in the Midwest. He's an outside dog that hasn't been given a preventative for 4 years. I'm thinking that heartworm could explain almost all of his problems, including a cough. The adult worms live in the pulmonary outflow tract, and cough is a pretty common manifestation. As I mentioned, I think a CBC or at least a PCV would be a good idea. That would allow us to determine if he's anemic, and the white blood cell count could help address infectious or inflammatory disease. If he has heartworms, for example, we might see eosinophilia. So to summarize, I think a fecal float, heartworm antigen test, and a CBC or PCV would be a good first step.